welcome our third speaker, Dr. Lakhani. He is a well-known consultant endocrinologist from Zydus Hospital, Ahmedabad. He is a founder of Mellitus Technology LLP and technoendocrinology.com. His areas of interest is implementing technology in various endocrinological diseases. He has achieved President NB Gold Medal in endocrinology, and he is a developer of several applications in an endocrinological education platform. Over to you, Dr. Lakhani.
Thank you, sir. So thank you for the kind introduction, and thank you to APRCon Rajkot for inviting me for this. It's, let me tell you, always a pleasure to be in Rajkot. This venue is fantastic. I think it's a great event, and we're just starting off, so I wish you for a great success for this event. So what I'm going to do is I'm going to, in the next few minutes, talk to you about CGM in 2025, what's new. While it's going to be, a clinical talk, it's also going to be a little bit of, a critique on how the society functions in a way, and also a lot of, how we probably can, be more entrepreneurial in this area, right? So that's the whole thing. So even though there is a clinical aspect, which is right at the end, there's also a little bit of a human aspect of this, which we're going to talk about. So when I talk about what's new, unfortunately, there is not much new, though this topic was what I'd chosen myself. But when I started making this presentation, I realized that there's not much new in CGM, right? We're probably in the same space which we were 5 years back, maybe even 10 years back. We are almost the same situation. Prices have come up and down. Maybe one generation of CGM has changed, but otherwise, more or less, we are more or less where we started. Though things have changed in other spheres around it, which is, what I'll, like I said, critique about. So I'm going to tell you three, call it stories, okay? First is what I like to call it CGM is cool. Second is what is known as plugged in. And third is, we'll add a bit of AI ka tadka there, right? Let me tell you this, and this is something which I recently had a very interesting conversation with a senior endocrinologist, and this is the outcome of this. And when I tell you this story, you'll realize that there is a bigger picture which we are missing out in our medical practice. So this is a forum which is for all physicians and above. I think the idea is that we are all part of a larger family. There is one aspect which we need to understand, and which is a very important aspect of Indian society. So this is an interesting story. So this senior endocrinologist was telling me that there's this elderly gentleman who came for the consultation with his granddaughter, and this guy has pancreatic diabetes and had a very labile blood sugars, right? So blood sugars would be sometimes very high, sometimes very low. And, so they were discussing with the grandfather that, you probably need to put a CGM, right? Because, this is something which is very important for your health. And there are times when this patient would get admitted with low sugar. There are times when patient will get admitted with high sugar. And if you have managed patient with pancreatic diabetes, you realize it's a very complex process. Because on one hand, they don't have insulin production, but they don't also have glucagon production. So sometimes they are having very high sugars. Their insulin requirement is also very labile, right? So things change very quickly, very fast. So this guy is saying that, sir, but, wo mongu pade che, expensive che, whether I'll be able to afford it or not, 5,000 rupiya nu che, 15 divse, so on and so forth. So while they're talking, this granddaughter immediately lifts her, a t-shirt, and she goes, Dadaji, etlu koi kharab nathi, right? It's not that bad. I am wearing it, see, right? So the endocrinologist is a little shocked. Okay, do you have diabetes? Why are you wearing this? He said, no, I don't have diabetes. I saw on Instagram, there was some guy who said that CGM Perwathi weight loss thai, right? Which is not true. But the point is, so I'm using it, right? Now here, the point is, this is the point of Indian society, which just today morning I had a similar conversation with my colleagues from Delhi, who are going to give a talk on tirzepatide in the afternoon. I'll tell you this area, right? In India, and this is a broad critique of Indian society, cool is more important than sensible, okay? Now, for years together, we have been talking about CGM is required, CGM is important, CGM is, improves time in range, improves patients' clinical outcomes. Patients will be like this, right? સાહેબ જરૂર છે નથી જરૂર તો પછી I am okay with what I am doing, right? You know, and then on the other side of it, we have this Instagram generation who is using, this lady is using CGM not because she's having diabetes, she's not even having pre-diabetes. She's using it because somebody on Instagram or somebody on Facebook or somebody on some social media is using CGM, right? And, you know, they are saying that, okay, this will help you track your, you know, your response, your, whatever you eat, how is it going to respond in your body and so on and so forth, right? And that's why she's using it, right? But, you know, if she was a type 1 diabetic and we told her, okay, you need to use CGM, nathi jarur, right? That is the reality of thing. Same thing, I'll tell you, same thing is happening if you remember right now in the GLP-1 space, right? Liraglutide has been around for many years, okay? After that, dulaglutide was also available for many years, okay? Nobody, your patients, you know, sahib bo mungu che, GI upset thai che, so on and so forth. Today, every day, I get 2 patients requesting, literally begging, ke sir, mane weight loss vado injection lakhi apo, right? It is happening every single day, right? The point is, I think there is a lesson. I mean, we can't change the society, right? How we can't change how people think. But when I was discussing this with my colleagues in the morning breakfast time, one thing they also realize, and I also immediately realize, is that we need to do more groundwork in the society to make these things acceptable and cool, right? Right now, I have patients, and this I've criticized this earlier. We have patients with type 1 diabetes who are ideal candidates for the most current, that is 780G insulin Medtronic pump, right? Their life will literally change. These are children who are again sometimes getting admitted with low sugar, sometimes getting admitted with high sugars, right? They are not compliant with their whatever thing. They are ideal candidates who you can put them on a 780G pump, right? And their life will change, right? Their parents own Mercedes Benz and Audis, right? But when you talk to them about a 7 lakh pump, they're bo mungucha, right? So I don't think it's their fault. It's probably from a society perspective, they have probably not seen any children wear an insulin pump. They don't know how it looks like. They don't know how it's going to work. There are a lot of questions about it, which we'll answer some of them, but they'll still, that network effect is so strong that maybe there will be some cousin of theirs who comes from USA, is wearing a pump, they'll accept it. But they'll not accept what you have told them in a more sensible way. So that's the reality of society, right? I think that's something we need to accept. CGM, thankfully, has got a lot of broader acceptance in the society, at least in non-diabetic people, not so much in diabetic people. So that's the reality. But then the question really remains, and this is a very important aspect. This is what is new in 2025. Should you use CGM in a non-diabetic patient? Should you use like this Instagram influencer or this lady is using it, who is not diabetic? Answer is no, you can't. Not with the current generation. And I'll give you a scientific argument for this. Unfortunately, we are in this era where, so currently we have 3 CGMs, only 3 CGMs available in India. 3 types of CGM available in India. One is Freestyle Libre, right, or Libra as they call it. Second is Medtronic's CGM, which is Guardian, which is mainly, they are only using it mainly for connecting with their pump. They are not interested in giving it for general CGM purpose. Neither are we using nor there. There is a third, a Chinese company called Sinocare, which is making a CGM called ICAN. So there are 3 companies which are having CGM in India. All the 3 companies have older generation CGM in India. All the 3 companies are international companies who have higher grades CGM in other countries. But in India, you have 1 or 2 generation older device. That is okay, fine, right? That's okay. iPhone also, we get the latest iPhone within 1 week, but we don't get the latest CGM after years together. But okay, accept that fact. Now, also we have to accept this fact scientifically that the CGM that is available in India, that is Freestyle Libre first generation, while you have 3rd generation in the US, we have 1st generation. The 1st generation has, for calculating the accuracy of a CGM, we use something called a MARD value. This 1st generation CGM has a MARD value of 12.5%, right? Which means that every glucose reading that you get is 12.5 plus minus, okay? Now, a lot of these people, and there are lot of startups, right? You would have heard some of them, Ultra Human and all this, some names, right? All these startups, what they're doing is that you wear the CGM and you see your personalized glucose response to the CGM. So, આજે મેં ઢોસા ખાધા તો એનાથી કેટલું સુગર વધ્યું, આજે મેં પાઇનેપલ ખાધું તો એનાથી કેટલું શુગર વધ્યું. That is what they want to check, which they feel is probably something which is critically important for your metabolic health, which is again not true, right? But having said that, let us assume if we do this also from as a curiosity exercise. Let's say your pre-meal blood sugar reading is 130 and your post-meal reading is pre-meal is 90 and post-meal is 130 and you are not diabetic. Just do a calculation. In realistic terms, your pre-meal sugar is actually 90 plus minus 12, which is about 78 to 101, right? So it is not 90, it is 78 to 101. Now, the amount of glucose that changes after taking a meal, right, in a non-diabetic person will be around 20 to 30 milligram per deciliter at best, right? So, and what is also well known and well publicized by the company themselves is that post-meal, the MARD value is actually higher. So even though the published MARD value is 12.5%, post-meal MARD value is 15%, right? So if your post-meal blood sugar is also 100, it is anywhere between 85 to 115. Now, if you are telling me that my blood sugar increases by 30 milligram per deciliter after taking pineapple, right? Remember, the MARD value is so high that the difference is actually more than the difference which is actually less than the error which you get from the device. So whatever all these companies are doing is complete nonsense, right? There is no science behind it, right? Your MARD, the inaccuracy of the system is so high that you will not be getting the real data of the personalized glucose response. Whatever you are getting is garbage data which has no clinical application. It is useful in diabetic patients, 100%. It has no use in non-diabetic patients. So, yet, boli na thaki gaya, people are not listening, but that is the reality. If you have a second and third generation, and a lot of these companies copy things which are there in the West. In the West, you have third generation Freestyle Libre, which has a MARD value close to 6%. In which case, it makes sense to use it in non-diabetic or pre-diabetic people, right? But Indian device is not good enough. So, if you have a non-diabetic person who wants to see કે મારું ખાવા પછી ગ્લુકોઝ કેવું છે, મારું એક્સરસાઇઝ પછી ગ્લુકોઝ કેવું છે, right? Discourage them from using CGM because they are not candidates for CGM. Rather, tell them that, you can make any charitable organization, whatever money, if you are so desirous of paying, give it to this charitable organization. We'll use that money to give it to some poor type 1 who probably needs the CGM, not you, right? Reality, okay. So, the MARD value, so conclusion is, do not use CGM for non-diabetic patients. It is not approved, nor is it recommended. So, if you ask me what is new in 2025, this is new in 2025, right? Indications in diabetes has not changed. People are now using it in non-diabetic patients, and what I'll say is, do not use it. That's the answer. Second point, another criticism, whatever you call it, another reality. In diabetes technology space, we are still disconnected, unfortunately. We have only 1 or 2 companies in India which make insulin pump compared to 13 companies in the US of all shapes and sizes. Obviously, you can't compare it with the US, I agree, but still, right? We have a large diabetic population, maybe that also means something. Also, so these are I already told you, these are the CGM devices available in India. One more thing I'll tell you, Ultrahuman, you would have seen this, Ultrahuman M1, right? There is a guy who came and said that I use Ultrahuman M1 CGM. I said, what is Ultrahuman M1 CGM? I have not heard about it. Then I realized that Ultrahuman M1 CGM is not Ultrahuman CGM, it is Freestyle Libre. In fact, I saw their, Amazon thing also. On Amazon also, they are claiming that this is Freestyle Libre only, right? So they are charging extra money, right, for a Freestyle Libre, for their software, which is also not accurate, right? I don't know what they are charging for, and I don't know why people want to spend money there, which is completely nonsense, right? But still, anyways, there is another one called Acrofit, same company, same type of modus operandi, and another big scam, right? India, you would have seen this non-invasive glucose meter. Haath jodine, please do not use this non-invasive glucose meter. It is not approved. It is not accurate. Currently in the world, there is no non-invasive glucose device which is approved, right? So there is one which is doing a lot of rounds in thing. Lot of other people also have criticized this, but please do not use it. Please do not encourage your patient to use it. It's not advisable, okay? How many CGMs are developed in India? Zero CGM. What is our population? 1.4 billion. What is the number of diabetic cases in India? Last recorded 77 million, right? We don't have a single company which makes CGM. Okay? So probably Piyush Goyal was right. Okay? So again, we have a lot of entrepreneurial spirit in Rajkot. Maybe, why not? I mean, we can make ventilators, we can make CGMs also, I think, right? That's what I feel. It's a far easy technology to develop. There is a big market, 77 million, and if you can get the right influencers, doctors ko bhuli jao, probably get the right influencers, you might be able to make good income out of it also. But the point is, we need endogenous CGM, right? Because, we need devices which are better, which are cheaper. In India, we can do this at a much cheaper cost in a better way.
Sir, 3 minutes remaining.
Yeah, I'll just finish. Yeah. So third point here is that, if you compare that with the West, right, these are the CGMs from the West. These are the CGMs from China, has 2 big companies, right? A lot of them from Korea. We are not still plugged into the system. Third thing, the final aspect of it is, AI is actually changing a lot, right? And though we have never been big on terms of hardware, we are big in terms of software, right? So at least that is something which we can develop and use. So made this it's a very simple thing. We made this system called the, you all heard about, you'd all heard about custom GPTs. We also have a software, but software is currently, we are testing that, right? But we have made this custom GPT. So this is freestyle. So we have this system which we developed. We actually written a simple prompt. You can just scan this QR code. In interest of time, I'm not going to show the video. But the idea is very simple. You can actually upload your patient CGM device, CGM report, right? And within seconds, you will get a detailed report, something like this, right? So I'll just show you the example of that. Okay. So this is the patient's CGM, right? We just uploaded this into the AI. Right? The idea is, again, proof of concept that AI can do a very beautiful interpretation of your CGM within seconds. So here it gives me the broad overview. What is the glucose management index, glucose variability, time in range. It also tell me the patterns, right? So which are the areas which we need to look at. So morning, the patient is having hypoglycemia. Daytime, there is a lot of fluctuations. Post-meal, there is again, some issues there, right? These are the weekly summaries. Give you a snapshot in terms of the percentage glucose in time in range. Ideally, this should be more than 70%. That's the ideal number. I'll give you a daily log. I'll give you the daily patterns and mealtime patterns, which are the areas where you need to consider. It'll give you the interpretation and mainly the clinical interpretation, right? So, the patient is not using sensor frequently. There is a lot of glycemic variability. The hypoglycemia risk is a problem, right? Again, so these are all the recommendations. Just a simple, upload to the system can actually give you a lot of information, right, from this. So just to summarize, again, from, like I said, a critique point of view, first of all, these are things which are new, right? So this is what we'll stick to. CGM is not for non-diabetic. Please do not use it in non-diabetic patients, right? Even if your patients insist. The time has come for us, and there is a lot of push from the government also to develop endogenous technologies. We need to develop a cheaper local CGM, right? We need to, right? Probably needed to do it 10 years back, but at least we need to do it now. Especially in the world of the Trump era of tariffs, it is required because otherwise CGM is going to become much costlier anyways, right? And AI, and we are, like I said, always good at software. AI can also be used very easily for CGM analysis. In fact, I encourage that we use it, right? Because it will give you a snapshot, it will give you a detailed report within minutes, where you can then share with your patient. Sometimes, even human point of view, we miss out certain things, right? For example, when I did my own analysis of this patient CGM, I missed out the point that she's having some amount of, late evening, peaks, which probably you often sometimes miss out, right? So then these could be areas where you could help. So it will give you predictive analysis and you can, implement this. Like I said, there is no commercial software right now for this. We made this, custom GPT, but we are making a little bit of a software there. But I think having said that, basically what you need is a good prompt, and any AI system will be able to give you a detailed report of the same. So I think I encourage you to use it, right? Because that's the future as far as CGM analytics is concerned. So thank you for a patient listening, and thank you once again for inviting me.